All of those patients reported some degree of improvement in their symptoms and overall quality of life, and many of them were able to reduce the reliance on conventional medicines and medications that they were taking, which is a trend we see quite commonly across the world in different areas of research with regards to cannabis and reducing down prescription reliance. Fortunately, most people who are in the UK that could benefit from these prescriptions and these medicines do not currently access one. That's either due to stigma, or they're feeling uncomfortable, or they're not even aware that this is an option. And finally, as well, there is a significant financial burden that can potentially come with these, depending on how much cannabinoid content you actually require for your symptoms and manage your condition. Now, a large reason for this hesitance around medical cannabis is primarily due to the stigmatization that still exists around crude cannabis consumption and cannabis flowers as a therapeutic. There is a long history of prohibition and very strict prosecution when it comes to cannabis as well. And so there is a lot of hesitancy, but also a lot of stigma that is still directed towards patients who do have legitimate cannabis prescriptions and legitimate medical needs. And so this creates a bit of a conflict and a lot of discomfort, and in some cases discrimination around patients that are using their prescriptions and following the rules and following the guidance that's been given to them by clinicians. But unfortunately, there is still an environment in the UK where general cannabis consumption and possession is highly criminalized. And so it's difficult for these patients within that small bubble who are receiving these private prescriptions to be acknowledged and also sort of assimilate and find ways to responsibly use their prescriptions and feel comfortable, like, where do I vaporize my cannabis? What do I do if I'm on the train or traveling or at the hospital? And so there's a lot of downstream problems and questions that need to be answered and solved as we expand the uptake and access for these treatments. There are a number of things that we can do to actually influence the endocannabinoid system and have somewhat therapeutic effects on the body without actually having to integrate cannabis into the human and patient themselves.